So for this week's topic, for our maternity Teach Me, we had postpartum. So here's my concept map. So what is it? Postpartum is when a woman is bleeding heavily after labor. It is very serious. It usually happens during the first day of birth, if it occurs, but it can happen up to 12 weeks after delivering. It is classified when the woman loses more than 500 mLs after a vaginal birth or more than 1,000 mLs after a cesarean birth. So PPH can cause a severe drop in blood pressure, which can lead to hypovolemic shock, and then obviously complications can lead to death. So how do we diagnose this? We diagnose this by determining the blood loss, count of pads, vital signs, H&H, PT, and blood type and cross-match. So signs and symptoms of PPH are heavy bleeding, a decrease in blood pressure, tachycardia, a decrease in hematocrit, nausea, pallor, swelling or pain of the perineum, uterine atony, blood clots larger than a quarter, perineal pads that are saturated in 15 minutes or less, constant oozing or trickling of bright red blood from the vagina, and oliguria. So conditions that increase the risk for having PPH are placental abruption, placental previa, enlargement of the uterus, uterine atony, previous history of uterine atony, high parity, mag sulfate therapy during labor, hematomas, lacerations, inversion of the uterus, retained placental fragments, multiple pregnancies, gestational hypertension, preeclampsia, having many previous births, prolonged labor, infection, medications that induce labor, tear of the cervix or vaginal tears, tear in a uterine blood vessel, blood clotting disorders, and a laparotomy and hysterectomy can be done. So what are we going to do as nurses? We're going to massage the fundus instantly. We're going to monitor vital signs, assess the source of bleeding, assess the fundus height and position, and if it's firm, obviously we know it's not firm. Assess the lochia, so type, amount, assess for bladder distension, maintain or initiate an IV if they don't have one. So IV fluids can be given to replace any volume loss. Administer oxygen, elevate legs, and obviously we want to call the provider before any of this. Medications to be given are oxytocin, methylarginine, mesoprostol, carboprostramethamine. I probably butchered all of them, but they are used to stimulate the uterus to make it contract. They can reduce bleeding, and they should be given immediately. So some client education that we can educate the mom on. We want to instruct the client to limit any physical activity to conserve any strength following this occurrence. We want to increase the mother's iron and protein intake, and we want to take vitamin C with iron to help its absorption. So that's postpartum hemorrhage.